3, 2, 1. Good afternoon. It is Tuesday, November 17th, and this is the Health, Hospital, and Social Services Committee. We have 4 or 5 pieces of legislation to consider. First is RS 2020-637, Taylor and Welsh. This approves a contract between the Metro Board of Health and the University of Nevada, Reno to provide experience opportunities for its students enrolled in its Masters of Public Health program. Do I have a motion? Second. Thank you. Any discussion? Do we have someone here from who can talk about this from the Board of Health? I don't see anyone here. Please.
This is Dr. Stephanie Bailey. She is the former mental health director.
Ah.
And she has been all things mental health.
Thank you, Ms. Bailey.
Thank you. I did not know this was on, but I can speak to that. We have to increase learning and development of confidence skills for public health. And one of our staff, actually an employee, has enrolled to get her master's degree. And to do she's been doing it at night and on weekends. And to have her externship or her capstone project, she's elected to do it with Dr. Celia Larson, who's over our strategic plan and evaluation at the health department. Dr. Larson is a psychologist, and so she's going to be doing her project out of the University of Nevada, but at the health department, doing a study that will help us with results. So,
thank you so much for that.
That
yes,
was an employee and is getting their degree from the University of Nevada?
Yes, ma'am.
Okay, I've had people ask me, why are we doing something with University of Nevada when we had all these local universities?
Yeah.
That's why, it's because it's an employee who's doing an online program.
That's correct.
Okay.
That's correct, ma'am.
That answers that question then.
Dr. Bailey, does this contract cost Metro any more than if she was already an employee?
No, ma'am.
No, it's all the same. Do we have any further discussion? Hearing no further discussion, all in favor say aye. Aye. Opposed? Any abstentions? Motion carries. Our next piece of legislation is RS 2020-638, Toombs, Taylor, Welsh, Bradford, and Hancock. This accepts a disaster relief grant from Hills Pet Nutrition Incorporated and the Association for Animal Welfare Advancement to the Metro Board of Health to provide funds for COVID-19 pandemic relief. Do I have a motion? Second. Dr. Bailey, can you speak to this? Okay.
I don't have much details about that one as I did, but I do know the board probably approved it, so that's helpful.
Do we have any discussion? Hearing no discussion, all in favor say aye. Aye. Opposed? Nay? Any abstentions? Motion carries. The next piece of legislation is RS 2020-639, Toombs, Taylor, Welsh, Bradford, and Allen. This accepts a grant from the Dorothy Kate and Thomas F. Frist Foundation to the Metro for the use and benefit of the Metro Nashville Social Services Commission, Metro Homeless Impact Division, to benefit the House Nashville program. Do I have a motion? Ms. Tackett, could you speak to this for us?
The grant that we receive every year, it's paying for moving costs. It fills some gaps that we have. We have about $120,000 in our operational budget to help moving costs for people from the streets and in the shelters, first month utility deposits, and then we have a partnership with MDHA and MOU through CDBG, that's Community Development Block Grant funding, also with moving costs. This is a special fund that will help fill the gaps that the other moving cost sources cannot fill. So for example, if people have arrears, that CDBG grant cannot cover that. They're only first month rent, utility costs. So this helps us really tie over to get the last barrier for a person that absolutely there's no other resource out there. So it doesn't seem to be like a lot, and for us it's really opening the doors that for people that the door wouldn't be opened otherwise. So we appreciate that every year.
Any discussion?
I have a question. So, I know that money comes in to the homeless projects that you manage, but there are other organizations and agencies that serve the homeless community, although it may not be the only service that's provided. What are you all doing to try to partner with some of those other agencies that serve the homeless community in terms of, you know, sharing some of the funds that you have? Because I do know that there are quite a few places where homeless actually set up, and there are different organizations that serve.
So we at the Homeless Impact Division at Metro Social Services do planning and coordination. So we are not providing the direct services and we're not running the programs. What we're doing is partnering with nonprofits. So nonprofits, if they have a client where they have tapped into this fund, for example, where they have tapped into all their abilities and they request some funding through us to really open that door. So it's really all about partnership with the community and the community providers. And that's how we're set up. They're requesting this. We are paying landlords directly. So it's just really a coordination effort for the community. Total, we are 11. 2 of those do outreach. Right now I have 1.1 full-time positions for outreach because they're also working with Metro Social Services, the other teams in the shelter. We do have a homeless management information system. This is a database that we're building up here in Nashville, and we are managing that on behalf of the community. We are also managing the coordinated entry process, which is that referral process and that big coordination. And that's kind of where most of the staff are focused on that planning and coordination. We have a ton of community meetings with the service providers to build that system and coordinated effort.
So the funds that you all get external to social services, does it go to social services and then they disperse to you, or does it go directly to you?
This one comes into, we are part of social services, so it all is under the social services, Metro Social Services. And we are just a division that do the coordination. And this is we have a special donation fund, a special designated fund set up for these type of moving cost donations. That's the House Nashville Fund. And this donation is going into that. That's a very small fund that we really just tap into for these gap fillers.
Right, that was
Yep.
this one and other donations, because I know you do receive other donations as well.
It's usually Boulevard Bolt grant, not the Boulevard Bolt. It's not really a grant, it's a donation that we apply for and on behalf of the community because they want us to do that. And then maybe a handful of checks. If somebody wants to donate, they can do that, yes. That is not much, it's negligible.
Okay, so the percentage of those funds that you get, how much of it goes to social services? Because I know social services still has to serve as the managing
For this one,
not for this, but for homeless, the homeless project being that you on the homeless commission, being that you come under Metro Social Services.
are you asking for indirect cost level? Is that, I'm not, sorry, I'm not understanding.
Well, not necessarily indirect costs, and that would be good to know if
Yeah.
you're speaking of indirect costs.
There is none on this one.
Okay, so no indirect costs, so
Not
no
under
money
definition.
goes to Metro Social Services.
No, this goes right back out,
Okay.
yeah.
So do you
Yeah.
have any funds that Metro Services get funds from?
No, I mean, are you asking about the current conversation around, but that's really around housing, the whole emergency solution grant, COVID dollars, that the federal dollars that are coming in, they are not even coming to social services. Are you asking about those 10 million? Is that?
No, I'm just asking.
Just this one,
if
okay.
any funds that come in specifically for the homeless, if any of that money goes to social services?
It's part as a partner. So if there is a client that works with a social service staff member, they are eligible for these funds like anybody else. Like StreetWorks would be, like Room and Inn could apply. It's the organizations that apply on behalf of a client, and then we pay the landlord, the electric company, we pay the moving costs directly. So that's how that's set up.
Thank you.
Any other discussion?
The House Nashville program, I don't know what that is.
That is the special designated fund that was set up under the prior director. It's not going, so any donation that we receive is going to this special donation fund to be utilized for exactly that purpose, for moving costs that nothing else pays, for any fees or arrears that the other dollars that we have are not paying for.
Wasn't familiar with that term, so I didn't know what that
Yeah.
meant.
Yeah.
Okay.
Your masks look exceptionally perfect and separate.
Well, we were actually in a meeting yesterday and we matched too, so it's kind of like, you know, we text each other and say, which one are you doing today?
It looks good on both.
Any other discussion? Hearing none, all those in favor say aye. Opposed? Any abstentions? Resolution passes. You're abstaining? Okay. Thank you. The next resolution is RS 2020-640, Taylor, Welsh, and Bradford. Approves an amendment to a grant agreement between the U.S. Department of Housing and Urban Development and Metro Social Services Commission to contribute to the national effort to end homelessness. Ms. Tackett, would you like to take the microphone again?
So some of our staff are paid for by grant from the federal government, and this is a grant extension that through COVID, usually the grants go from July 1st through June 30th. They granted an extension to spend down that grant, and that's just a straightforward acceptance on that.
Any discussion? Hearing none, all those in favor say aye. Opposed? Any abstention? Resolution is approved. We have one late filed resolution from Hall, Vircher, Taylor, and Welsh. This is a resolution requesting Mayor Cooper to immediately cease the wind down process at Bordeaux Long-Term Care Facility and work to secure an agreement with an emergency operator to keep the residents safely in place during the pandemic. Do I have a motion? So moved. Second? Hearing it properly seconded. Mr. Hall, would you like to speak to this?
So this is one that we discussed in the last couple of meetings. There's been additional clarity in the process because what we decided or what we've learned through these last couple of meetings partially was that how we came to this point. The fact that you've got decisions that were made by previous council bodies that led to this or created the scenario for this is what led us to actually come back with this piece of legislation. What I'm looking at now is, because of the situation, we're looking at what we need to do in terms of right now. We can have conversations about emergency operators all day long, but right now what we need to do is stop this wind down and look toward how we can secure what's there in terms of residents currently. I don't know if anybody's been following along through the media or not, but we've had several deaths just in the last month that we've been discussing this through the last couple of meetings, with someone else going to the hospital today, and hopefully they make it back out. But we went in this situation knowing the reality is, in these situations, 25% of the residents who are displaced or moved suffer from trauma and don't survive that move. And so that's what ultimately led to us coming to this point, and why we need to stop and take a hard look at how we're approaching this situation currently.
I actually understand there was an additional death today of one of the patients who's being moved. Is there someone from the administration who'd like to speak to this? Mr. Jameson?
Thank you, Chairman Welch. Mike Robinson from the Mayor's Office. I hope every council member had the opportunity to receive the letter that they received from Signature's Chief Operating Officer yesterday, in which he explicitly declares that
so sorry about that. Can't hear you back.
the Chief Officer for Signature explicitly declares that the transfer, eliminating or halting or slowing down the wind-down process is not in the best interest of the patient. And that is what is fundamentally important here. And we hope and trust that the council members are with us in prioritizing patient care and not prioritizing bed licenses for somebody to make a profit on down the street. What's important is the care and safety of these remaining, I think it's now under 30 patients. The predicament that we're in now is that with Signature engaging in the wind down, that they were obliged to under the contract that they negotiated. They're down to 30, less than 30 patients, but their costs remain consistent. They have the same salary costs, all the other costs remain consistent, and so it becomes untenable. And as they lose their senior staff, who understanding that Signature is going to be out of business at the Bordeaux facility in January, they're moving on to other locations. That is a recipe for disaster if you don't allow the transfers to continue. I do want to address this notion of the deaths. Signature averages for this very high-risk population averages 2 to 3 patient deaths per month. That will continue. That has nothing to do with the transfer. A high-risk population will experience mortality irrespective of the transfer. Our hands are tied because HIPAA absolutely prohibits the repetition of any information regarding any deaths. Signature acknowledges one death that was not to have been reported. Anything else is a violation of HIPAA, and any additional repetition of HIPAA-protected violation information is a violation. But by winding this down, if we go to the operator, the individual who's currently in charge of patient care, he is telling you in writing, halting that is not in the best interests of the remaining patients. And if that is truly the priority of this committee, we cannot fathom why you wouldn't pay attention to the care providers and not allow the transfers to continue. The transfers are ongoing. They are up to the patients. Signature provides over 24 facilities that they can go to, recommends the 3 that are in their best interest in their locations, and assists them in picking a location to go to voluntarily selected by the patient or their families or their guardians. Again, I would urge you to read the letter from the Chief Legal Officer at Signature, follow his advice, and continue the wind down patient for the good of the patients, which is what we're all here for.
Discussion? CM Benedict, you have the floor.
So I have a few thoughts, and we have a bill that is on second reading in addition to this late filed resolution, and both have to do with this facility. And what I'd like to make sure that we talk about, and maybe we need to pivot this committee based on what Mr. Jameson just said. I want to make sure I feel like I'm in stereo with 2 here. I hope everyone can hear me. In fact, I'm going to take the risk. So I'd like to pivot the focus of this committee and potentially this council and perhaps the administration in order to address future concerns, because it seems to me that it may not be feasible to derail the train at this point, as Mr. Jameson just talked about the things that are in motion. So I don't know that we can derail the train as it relates to both patients and employees, and partly because if we can't use CARES Act funds to affect change by the end of this year. 44 days from right now is December 31st. So if we cannot affect change between now and then, if there's not enough operational funds available to take on the management of the Bordeaux long-term care facility, then I want to make sure that we do all that we can in the immediate future. We also could have a conversation, maybe an academic conversation about how events should have been handled. But that's not what will help. That's not what will help patients and employees at this point in time. We can have that academic and conversation anytime, but time is of the essence right now about these patients and about these employees. And so to deal with the immediate issues, I would respectfully ask my colleagues in committee as well as on the council floor to look at two separate issues. One, of course, is the patients and the other is the employees. But first, in the transition of these residents, I'm not talking about the transport of these residents. I'm talking about the transition. In the senior health community, it's known that moving a long-term care patient down the hall within the same facility can create a traumatic and potentially fatal outcome for that patient. Just down the hall, let alone into a different facility. And so while I may trust what I've been told, that the transport of these patients from Bordeaux to other facilities, while I may very well trust what's happening, and I do believe that that is handled with integrity, I don't believe that when we focus on transport, we're talking about transition. Those are two different things. I know that the last time that I had to move, it was pretty disruptive to my life. And I'm not someone who's been put in the care of other people. I'm someone who has control over my own life and the things that happen. But when I had to move from my house to another house, it was not comfortable. Let alone, I can't imagine relying on other people to make that transition possibly comfortable. If there's a way to use our CARES Act funds, or 4% funds, or with any current operational budget to ensure that these patients have a successful transition, then perhaps we can use those funds, CARES Act or otherwise. I think we need to make sure that as a city, we monitor the well-being of these patients during their transition to their new home. This is their new living environment. We need to make sure that they are safe. If we cannot derail this train right now, if that's not the right decision, then it's our responsibility to make sure these folks are safe. They are in our care. It's up to us to make sure they will survive this transition, and I'm talking about survival right now. I'm talking about making sure they don't get COVID. I'm talking about making sure that they know who their new nurse is that will bring them their medication 2 or 3 times a day. I'm making sure that they know the person who brings them food or picks them up and wheels them down for dinner at the community dinner table. These are the people that we're talking about. They have relied on us to take care of them. If we cannot, and it seems not to make financial sense to me, and I hate it, but it seems not to make financial sense for me to keep this single facility open. So if we need to close this facility, then we sure ought to take care of these patients. And I want to say not just these patients, but these workers. Those patients know that person down the hall. They know when they push a button that Emily, hypothetically, is coming to answer the call. We need to make sure that that sense of security is there for them, because if that doesn't happen, and I will tell you, I know through personal relations that if that person is not there to answer that call, they don't know who isn't coming. They don't know, and they sit there in a panic and they can't get relief until someone is there. Our job as a city is to make sure that that does not happen to them. So what can we do? Can we use CARES Act money? Can we find operational budget? How can we make sure this happens? And I believe that's our job as a committee, is to find a way. The CARES Act money is only available until December 31st. I don't know how we make that happen between now. What I would like to see the administration do is to find a way, and it can't be CARES Act money. It has to be some way to financially find a way to make sure that these folks are taken care of. Can we inspect and make sure that where they go, if they're going to go somewhere, and we've got 32 patients left as I understand it, if we can ensure that the patients before them, in addition to the 32 patients left, but to the 100+ patients who have left, is there a way that we can use our resources? If we cannot leave this facility, if we cannot keep this facility open, is there not a way for us to use our financial resources as a council and move money towards making sure that these people are safe for the next 6 months, for the next 30 days, for the next 3 months, to find a way to make sure that we have the money to ensure that they're not moving to a place where then they die, so that they move to a place where they have care, where they have people around them who care and who love them and who have access to them at a time that people like me don't have access to seniors, to people like me don't have access to our friends who are in the ICU. I'm almost nobody compared to all the people out there who are dealing with this issue. We as a city need to make sure that these folks are getting the resources that they need. And if we can't keep this facility open, if it turns out to be the right decision, then as a city, we need to do all that we can to make sure we are giving all that we can to ensure that they are safe in the days to come and until the days where they may go and where things end up. And with that, I appreciate the indulgence. I know I spoke for a long time. I think this is critically important, and I hope that out of this committee, we can say, let's ensure the administration is working its way towards a solution, whether that's, and hopefully that's through funding that tells them, here's how you will use this funding, and it is to ensure that these patients are taken care of. And then let's talk about the employees, which I haven't even touched on. With that, thank you.
The administration is going to tell us that all of those things are happening. It's about being intentional and deliberate. Apparently, they have not been reading the letters from the employees. They have not been reading the letters from the SEIU. They have not been reading the letters from the community. The intent was to have the wind down. The intent was for this facility to close. But should it is nothing that we can do, the administration and
My understanding is there's $3 million still left in the subsidy. Can someone from the administration or from our legal department verify that? How much money is left in the subsidy?
well, let me just say this too. When you talk about transitioning and moving, based on a letter that we already received, some of the other facilities that they have been moved to has less rating than Bordeaux had. But if you ask, it's going to be said that they are moving to facilities that's giving them great care, and it's all been done with integrity, and everything has been done correctly. Do we have any way of verifying that? Do we have any way of ensuring it as you are requesting?
My understanding thing also is that most of the patients are moving to other Signature facilities. Can you verify that, Mr. Jameson, as well as the amount of money left in the subsidy?
Several points to address, and I guess we'll just start with the supervision that the administration has provided for the patient transfers. Again, Signature is providing each and every patient with the options to go to more than 24 facilities, and the patient selects. Now, until last month, this particular facility had a 1-star rating. So how you're transferred to a facility that has a lesser rating than that, I don't get that. I just don't honestly understand that math. But in September, they got, after years, a 2-star rating. I think by and large, the patients are picking higher ratings facilities with fewer or zero COVID outbreaks compared to what the Bordeaux facility had. Are you going to find 1 or 2 that went to a 1-star after September? Maybe. But by and large, at the end of the day, it's the patient's choice. SEIU negotiated in good faith with Signature regarding the severance package and exactly what would happen pursuant to the wind-down process in the contract. That is a matter of contract with Signature. We do not have the wherewithal to tell them to just stop. And if we tell them to stop the wind down and keep operating, they're under no obligation to keep operating. I don't know who we put in there to suddenly operate a facility when they have to be licensed. But at the end of the day, we can have a group of politicians and bureaucrats tell you what we think we ought to do with the patients, or we can ask their doctors and their healthcare providers, and they are the ones. If I can finish.
I'm not using politics in anything that we're doing. What I am doing.
But if we can ask the doctors what's in the best interest of the patients, if we can ask the doctors, and when you ask Signature what is in the best interest of these patients, it is not to stop the wind down.
Proper planning prevents poor performance, Mike, and you know that discussions about this took place long before November.
Beginning in 2014. Beginning in 2014.
It began.
When the body decided.
Long ago.
In 2014.
For this transition, and that's the only thing, is that for us to show some compassion for the people who are there, show compassion for those people who have worked there and given their lives. People don't work there because they're getting paid extraordinary amounts of money. They work there because they love what they do. They love those patients. And we're just throwing them out the window.
We are not throwing them out the window. And why you would say that about any of the facilities that are accepting these patients?
We could have done better planning.
If I can finish, all of the facilities to which they're being transferred have wide vacancies, and they are being welcomed. All of the patients have complete coverage. There's not anyone being kicked to the curb, not anyone whose medical care isn't being prioritized by this administration. But starting in 2014, the council looked at the charter, section 1.05, and looked at the obligations that Metro has that includes healthcare provision, and stated in a specific ordinance that it declares that function with respect to Bordeaux to no longer be necessary and to be obsolete, to exit the long-term care provision, and to transfer this to a privatized facility, and to end the subsidization by 2017. By 2017. I don't know what the plan was then, if it's objectionable now, but that was the will twice by council in 2014 and in 2016. In 2016, it passed unanimously, 36-0, and 19 of those council members are going to be on the floor today. That has been the plan in place from the beginning. And why? Because the council determined in 2014 and in 2016 that for whatever reason, the private sector is doing a better job than a government-run operation. And if you look in the entire state of Tennessee, you won't find today a single other standalone long-term care facility that is publicly subsidized, because the private sector is doing it better, and they're doing it at no cost to the local government. They're getting better care.
According to this letter that Mr. Freeman sent to us, it says that 1 star by Medicare has rated Bordeaux, which is inaccurate, as the facility is rated a 2-star.
As of September, last month. That's when they got the 2-star rating. For all of the years before that, beginning in 2014, 1 star. And you, council lady, spoke passionately about the poor quality of care that was being provided at Bordeaux.
By
You spoke
signature
passionately.
initially
If
when
I
they
can
got
finish,
there.
you
It
spoke
was.
if I can finish, you spoke passionately about
I
demanding.
just don't want you to try to use my words against me because you know where my heart is and what this is about.
Please let Mr. Jameson finish. Thank you.
You signed on to legislation, expecting and demanding that they increase their performance over the 1-star rating. And you did that, what, 3 years ago? And they got it in September? That is the utmost quality that we are trying to pursue, is the safety and well-being of all of these patients. Each transfer goes underneath the rubric of the State Department of Health that monitors the transfers. And at the end of the day, it's the medical professionals that tell us what's in the best interest of the patients. And they are today telling us, continue the transfers. Do not interrupt the wind down. And I don't think it is our place to second guess the medical care providers and assume that that can be done differently. I understand the preservation of the bed licenses. I understand the possibility of the transfer of those bed licenses to Nashville General or some other provider. That is a secondary issue that you can address later. But right now, the priority is on the patient care. And right now, I think the priority is incumbent upon us to give deference to the medical providers in terms of what their opinions is what's best in their interests.
Mr. Hall, would you like to respond?
So, I'll be really brief. We're having a conversation right now about patient care versus a business decision. But business decisions led to this situation. If patient care had been the priority, we wouldn't be having a conversation about 1-star or 2-star ratings. The fact that we reduced the subsidy to this facility and passed legislation to wind down over time, basically, was a business decision. It wasn't about patient care. There's a reason this is the only facility of its kind, and the need for it and why it exists, because we don't have a very good healthcare continuum. As far as Nashville goes as being a healthcare mecca, we have a horrible healthcare continuum situation in this city, knowing where patients are going to go before they get somewhere and where their next destination is, how to transition them from one situation or location to the next. That's all that should have been about, but that's not what the case has been. And if we've been told that previous councils made the decision to create this situation, then the decision to wind down should be with the council and not with the administration. It should come back to the council for a vote to initiate or continue a wind down, not an administration decision. Signature's gonna do what Signature's done or asked to do per contract, or what money dictates. If you ask Signature today, will they take money for an extension? I bet they would probably take it, because that's what's happened the last few years. We've done extension after extension. No one ever bites on the RFQ the first time it goes out. It has not happened at this facility in years, because people will only take this facility who need to have a loss on their spreadsheet at the end of the year. That's why, because there's no money in it for someone to take. So let's take money out of the conversation and equation, with the exception of the fact that there's remaining money sitting there that was already allocated that we need to account for. And if it's not going to be spent there, we want to know where it is and where it's going, because we're right now in this council mode of reallocating and reappropriating funds magically to different places. If we're going to close the facility, okay. If we're going to wind down and do this, okay. We can debate the conversation around whether it's good for them to move or not. Everybody knew 25% don't survive a transition because of trauma before the wind down. So HIPAA aside, we can say lives have been lost. They would have been lost anyway, but were those lives lost by people who are still there and hadn't been moved, or people who were moved? We're not going to play semantics with this. Either we're going to take care of people or we're not. Either health care is the priority or it's not. Is this a business decision or is it about patient care? Because CARES Act money, any other money in the midst of a global pandemic, we're still talking about. We just got through talking about the Homeless Commission and the dollars associated with it and the help that's gone in. The money that we've given the last 3 months for music, for arts, for other things. How is any of that a priority over human life? I don't care about the budget. What's the budget got to do with saving a life? We take losses on stuff all the time. So are we gonna take a loss to save somebody and ease the process that is going to happen anyway? Have we not done that before? We want to talk about core civic and assuming responsibility for coverage? Come on, guys. We're better than this. And I don't want councilmatic courtesy and decorum to decrease anymore. I don't want us to be locked in these constant battles over different things like this. This is a simple conversation and solution. What are our city's priorities? Who are we here to serve and take care of? Let finance and everybody else worry about the rest. Who are you put here to serve? Who are you put here to take care of? What is your priority?
To remember that what we're voting on tonight is whether or not this committee is going to approve this demand of the administration and bring the conversation back to what we are actually voting on here in the resolution.
And I was going to say, to that point, I've had conversations with the chair. I've had conversations with legal and administration today where we've talked about some things that can be done. We're getting closer, but we've gotten bogged down in a couple of scenarios and situations that have taken the focus off of what's best for the patients. That was the point of that. But you guys are going to vote, you're going to decide, and then we'll determine the next step forward.
So, in regards to this piece of legislation, the reality, there is not a sin that the city wants to get out of the long-term health care business. There's nothing wrong with that. However, we're in the middle of a global pandemic, and we've given some of our most vulnerable population only 3 months to make a decision where they want to go after they've been in a space that we've provided for several years, 20, 30 years. In regards to moving patients and medical analysis, I'm not going to argue a medical analysis, but I will argue transitioning, such as my colleague Benedict did, is that when we're giving this amount of time in such a time as this, that's not the best thing that we can do as a council. Finding time to halt this transition. Currently, at the moment, I've asked as a chair, along with many of you, for 5 weeks to give Metro General an opportunity to have an assessment of how they can manage this facility. If we're down to 32 patients, we understand that. We may be down to 2 patients, and those 2 patients may not be able to find somewhere. So it doesn't matter if we have 132, 332, or if just we have 2. It's our responsibility as leaders in this city to manage this situation the best way we can. But having a rush to move, and I've talked about this in many different ways with this council body, but having a rush to move, to do something different. We're rapidly moving individuals that have a very short amount of time to make a decision if they would like to move or not. And I'm not certain to know if those decisions are 100% in the conversation and if their caregivers and families are added to this conversation as well. So with this piece of legislation, and I ask my colleagues, I ask the administration to pause the wind down. And I'll tell you, I've reached out to Signature and their leadership, and they have yet to come and speak with this council at this table. The most conversation with Signature that I've heard in a public setting has been through our administration. And so we can't make them come, but there's certain opportunities that we can do right now, and that's to give time in a global pandemic where individuals in this population are at the highest risk of losing their lives to take a step back, receive some information that we've asked for, to have an emergency or prolonged emergency care facility. We don't have to keep it open forever. I don't think we're asking that. Again, it's not a sin to close the doors and for the city to get out of this business. But with planning and more time, I think we could do a better job not only for the families and residents of Bordeaux Hospital, but also 200 employees that after January 22nd, Councilman Benedict, will not have a job with the city. So I ask you, colleagues, to support this resolution, and thank you for your indulgence.
And with that, I think I would like to wind this discussion to a close. I think we can look in to see how much of the subsidy is left. In fact, if it is $3 million, and then work knowing that we have that subsidy still remaining, and decide have further discussion about how to use that money and what we can do with that. So with that, do I need to read the caption again? Do we know what we are voting on now?
Please do.
Okay. We are voting on a resolution requesting Mayor Cooper immediately cease the wind-down process at the Bordeaux Long-Term Care Facility and work to secure an agreement with an emergency operator to keep the residents safely in place during the pandemic. Yes, some limited discussion there, CM Benedict. Okay.
We can stop this tonight. We can stop this on the floor tonight. What I am most concerned about is, regardless of the remaining 32 patients left, I'm concerned about those who have already left. And I'm concerned about the 32, where they're going. So as it relates to the wind down process, I would hope, and I so badly want to support this resolution. I believe what we need to do, and it's a memorializing resolution, right? It's basically saying, hey, Mayor, do this, please. I would much rather have a conversation with the mayor and get commitment from the administration tonight to say, we're going to do more than just what you've asked for in this resolution. We're going to do more than go through an emergency operation. Anyway, I would, if we need to pass this to make that happen, I'm for it. But I would hope they will do that on their own. Thank you.
Yes, I have a question, in that we could pass this resolution and all feel good and pat ourselves on the back. But what I'm wondering, if we pass this, what happens to the patients that are there? Because as you all know, when you're given a date that your job is going away, you don't wait for that date to find a new job. You start looking elsewhere. So my question is, if we were to pass this, what's going to happen to the health care of those patients until they do leave? Are there going to be adequate nurses? Are there going to be adequate people in the kitchen to prepare their food? So Mike Jameson, could you speak to what would happen if we do this resolution and we feel good and, you know, hallelujah and all that? What happens to those patients? Are they going to be in worse condition than if we allowed this to continue?
Precisely the problem. And that's why Signature wrote to you yesterday and said, and I quote, most importantly, we do not believe that it is in the best interest of the remaining patients at the Bordeaux facility to interrupt the process now. Why? Their employees are leaving. They understand what's going on. They're going to other facilities. If you have a maintained patient population and a dwindling staff to take care of them, do the math. That also explodes the expenses for Signature. If you maintain the patient population, as it dwindles, their expenses stay at the same rate. If you close it out, the sooner you close it out, the more of the $6 million is left over for reseeding the next operation, whatever the council may decide that is to be. But I just cannot implore the council enough not to make these patients a political football, but to follow the advice of the caregivers now. The doctors now say, please keep transferring them. The signature staff is dwindling. And to ignore that, I think, is the worst mistake you could make.
And is that, you know, what sounds like a good thing could possibly actually be harmful for the patients. And
You're back on the vote. Oh, I'm sorry, I didn't. CM Porterfield?
Thank you so much. I was socially distant over there. I just have one quick question. Has anyone spoken with the families of the patients that are remaining? And do we know what the families are actually asking for and what they want for their family members?
CM Taylor, do you?
I've been contacted by family members. We received letters by family members. And all of the emails and letters that we've gotten, people have been asking for us to save Bordeaux. They don't want to leave.
Thank you.
We are on the vote. I don't think I need to read the caption again, but I'm happy to if anyone is still unclear. Yes, on the late filed resolution. Right. This is on the resolution. The late filed resolution. All in favor say aye. Aye. Opposed, no? Is that Gloria and Russ? Any abstentions? Resolution passes. Our last piece of legislation for this evening is a bill on second reading. This is BL 2020-505 from Hall. It directs Metro Purchasing Agent to enter into an emergency contract for the continued operation of the Bordeaux Long-Term Healthcare Facility for the remainder of fiscal year 2021, and affirming the council's intention that the current appropriation in fiscal year 2021 operating budget for the Bordeaux Long-Term Care Facility Management be used to fund the emergency contract. Do I have a motion? I believe this is actually already deferred by rule. Is that, Mr. Cooper, is that correct?
The sponsor is here. It was deferred by rule last time. It may have been deferred by rule in budget and finance, but that's
yes, in budget and finance.
Right. And so if the committee wants to defer it, but it's not automatic.
Okay, so the motion is to defer one meeting. All in favor, say aye. Aye. Oh, I'm sorry. Discussion.
By rule, so it's automatically deferred one meeting. Okay. Yeah, we don't even have to.
So we don't even have to vote?
Nope.
Okay, great. And with that, I will entertain a motion to dismiss. Good to go.